I'm proud to talk to you today about the Michael E. DeBakey Veterans Affairs Medical Center. We are one of the largest eye clinics in the country. We are also the only standalone eye care line in the VA system. The eye care line is comprised of ophthalmology, optometry, and low vision services. We are affiliated with 8 community-based outpatient clinics treating patients from Southeast Texas to Southwest Louisiana. We offer ophthalmic care in all the disciplines. Our faculty is comprised of 17 Baylor-affiliated specialists. We see approximately 55,000 patients a year, which accounts for 18% of all outpatient visits. We also perform 2,000 surgeries, which accounts for 20% of all surgery done at the Houston VA. Our 10,000 square foot clinic features 35 examination lanes and state-of-the-art diagnostic equipment. To help us see this large number of patients, we have 12 technicians, 4 nurses, and 7 optometrists. The VA experience provides our residents critical clinical and surgical education. Our busy clinics expose them to a multitude of diseases such as glaucoma, cataracts, age-related macular degeneration, and diabetic retinopathy.
The VA is a huge part of our training at Baylor. It's an inviting and spacious clinic, and each resident has their own fully equipped exam lane. Here we really get to grow in our autonomy and clinical decision-making skills in a fully resident-run clinic. We learn bread and butter ophthalmology with appropriate faculty supervision available at all times. We also have excellent support staff so that we can really focus on our learning and development as ophthalmologists. We have friendly technicians and nurses that are always willing to help and work up patients, perform FAs and OCTs, and IOL calculations. Add to this our social workers, low vision services, and optometrists, and it's plain to see that we really get the support we need at the VA. At the end of the day, none of the residents leave until all the patients are seen. Seeing your co-residents every day and sharing patient responsibilities really engenders a sense of teamwork. Within each class and between classes, the residents are all very close. I think my co-residents at Baylor have really made my experience special.
The VA is such an asset to Baylor's ophthalmology residency training program. Residents begin training at the VA during their joint internships, giving them 4 months of clinical experience in ophthalmology. Our general and subspecialty clinics allow residents from the beginning of their training to perform and quickly achieve proficiency in-office oculoplastics procedures, glaucoma and retina lasers, as well as intravitreal injections. More than half of the surgical experience that our residents get as primary surgeon comes from the VA. In the fall, first-year residents complete the IC surgical simulator training and perform portions of senior residents' cataract cases as part of the program's surgical curriculum. Then, in the second half of the year, they begin to perform intraocular surgery as primary surgeon, completing several cases by the end of the first year of training. As second-year residents, they perform around 30 to 40 intraocular cases at the VA in addition to strabismus surgery. In their final year of training, residents rapidly increase their surgical volume, doing 15 or more cataract surgeries a week, in addition to glaucoma, retina, and oculoplastics procedures. The eye care line has dedicated ophthalmology operating rooms staffed with specialized eye nurses and anesthesiologists who are all well acquainted with our ASC-style flow. Our teams work together to turn cases over quickly, allowing us to maximize caseload each day. At the VA, residents use state-of-the-art surgical equipment for their cases, including Centurion phaco machines, the LensX femtosecond laser, and the Aura intraoperative aberrometer. Once comfortable with their surgical skills, they're also given the opportunity to operate using the Ingenuity 3D visualization system.
The operating experience at Baylor is second to none. Most of our volume of cataract surgery comes from the VA. I believe the most important features of a good surgical training program are the patient population, the technologies available, the OR space and ancillary support, and the attending staff. The VA really provides it all. Our surgical schedules are always packed because they're fed directly by our outlying VA satellite clinics. A real asset that helps us manage this large volume is our surgical scheduler. Unlike other programs, we have nurses assigned to organize the surgery schedule and a wonderful PA that performs our history and physicals, which relieves us of that burden so we can focus on our cases. On any given day, we run 2 to 3 dedicated eye rooms staffed with surgical nurses and OR technicians specifically trained in ophthalmic surgery. We're fortunate to have the latest technologies available at the VA, and the VA fights every year to keep us on the forefront of our specialty. And most importantly, we have world-renowned faculty who know how to leverage these technologies and have years of experience teaching residents. Our attendings are so wonderful to work with in the operating room and really put our surgical experience first.
I personally find, and I know our residents do too, that it is very rewarding to work at the VA. Our veterans deserve absolutely the best care, and we are happy to provide it.